Hello, can you hear me? Oh, goodness. Jan Scott here?
Yep. Hi, Jan. So here at Hospice UK. Welcome, Jan Scott. I think we've got two Jans.
Sorry, can you hear me? It's Jan Codling.
Yeah, I can hear Jan Codling, yeah, and I think we just got Jan Scott joined as well.
Right, it's just that for probably the last 10 minutes I've not actually been able to hear you. We all
had it on mute? Yeah, we had it on mute.
Fine.
Yeah, we were just sorting out a few technical things, and I don't think you wanted to hear us going on about all our technical things.
That's fine. I was just concerned I've done something. Okay,
yeah, we've unmuted now, so you can hear us all loud and clear.
Great.
Start in a minute, and I'll do a round of introductions then.
Okay.
Right, I'm told we're dead on 3:30 now. Anyway, well, welcome everyone to the MCF Bereavement Project Leads webinar. This is following our Project Leads Day. I thought it'd be really useful to do a round of introductions before we all start. So I'll start here with Hospice UK, who's in the room. So, Marie?
Hello, I'm Marie. Nice to see everybody again, virtually, and nice to welcome Jan Codling as well.
Hello, and those of you who don't know me, I'm Claire. I'm here at Hospice UK, and we've got our speakers here.
Hi everyone, I'm Alison Penny. I'm coordinator of the National Bereavement Alliance and director of the National Children's Bureau's Childhood Bereavement Network.
Okay, so can we go around everybody that's online?
You guys can't see me, but I'm Heather. I'm the clinical team administrator, so I'm going to be working on some of the technical issues back here. If you have your microphones on and you are not speaking, can I ask all of you to keep them muted? Otherwise, we're going to get some feedback. And then you'll be able to unmute yourself whenever you'd like to speak. We also have a chat box available if any of you can see it. And if you have a question, you can type it into the chat box and I'll be monitoring it.
And also to say, if you haven't been on these before, this is obviously just all a learning experience. I think we've got some feedback already.
I think it could be Jan. Jan's on the computer and the phone.
Okay, all right. Can we go around there and just introduce everyone who's on the call? And if we sort of have everybody muted until we sort of come to questions, is that okay? So can I start with Jan Codling? Can you introduce yourself, Jan?
Yeah, I'm Jan Codling. I work at St Anne's Hospice and I'm the lead for quality and audit.
Thank you for joining us. Christine?
Christine, can you hear us?
Okay. Jan Scott? Hi, Jan. Can you introduce yourself? Joe, can you hear us?
Hi, it's Lindsay Lawson from the Family Support and Bereavement team at St Mary's. Joe's actually on leave at the moment.
Oh, wonderful. Okay, so we've got Linda. Brilliant. Lindsay, sorry, Lindsay.
Yeah, thank you.
Okay, brilliant. Okay. Who else have we got? We've got Maz. Do you want to introduce yourself?
Hi, I'm Maz Cole from Compton Care. I'm the Community Engagement Coordinator and I'm coordinating our bereavement information hubs.
Fantastic, great. And Joe Blake?
No, that was
the one that.
Oh, that's the one that's come. Sorry, Jack.
Okay.
Sorry, Lindsay.
You're okay, don't worry.
I'm getting confused. Doesn't take much. And then we've got somebody in the shadows. Is that Paul? Paul, can you hear us?
It says owner, doesn't it?
Yeah, we got owner. Oh, this is fun. The joys of technology.
Okay, so Christine Warner can hear us, but she doesn't have a microphone. So she's trying on the computer.
Oh, okay. All right. Fantastic. Great. Thanks, Christine. And
We need to really text
Paul.
owner, which is true.
Paul, can you hear us, Paul?
Okay, Jan Scott's back. I couldn't make the system work, so I'm on the telephone now.
Okay, great. So you can hear us now, can you, Jan?
Yeah, it's very faint, but yeah, I can just about pick up on you.
Okay. I think sort of bear with us, and then we can sort of see if there are ongoing problems, then we can sort of address those as we go along. But we can then feed them back to our team, because we're actually looking at how we can get these to work even better. So if you just bear with us, if that's okay.
Can I just...
Oh, hello there. You can probably see me on the phone, but I didn't have any audio. Sorry about that.
Okay, so you're going to talk to us via phone, Paul. Is that all right?
Yeah, at least you can
Brilliant.
see me as well.
Okay, yeah, we can see you in shadow. That's fantastic. Thank you very much. Have I missed anybody that's on the phones?
Can I just... It's Jan Scott here. Can I give my apologies that I need to go at 4 o'clock because I have another meeting? I am sorry.
Okay, so what we can do, Jan, is maybe get you to just present straight after Alison so that we don't miss out on you.
Yes, of course.
Is that all right?
Yep, no problem at all.
Okay, fantastic. Right, so shall we hand over to our first speaker then, Alison Penny, who's just introduced herself, who is coordinator of the National Bereavement Alliance and director of childhood bereavement. And we're focusing very much today on measurement and evaluation around involvement, around bereavement. So Alison, I'll build you up. You are one of the experts in this area. She's now putting a face, so you can see her, and she'll be sort of give us some food for thought and then questions afterwards. Is that a good build-up for you?
Thank you very much, Claire. I was putting a face because I sometimes wonder how it is that I can become to be presenting about capturing experiences or evaluation and assessment, given that I'm usually the person that is scrambling to write an evaluation form just before an event starts or we get going on a conference. I've been involved in various projects over the last few years, both at the Childhood Bereavement Network and at the National Bereavement Alliance, looking at ways of evaluating and assessing bereavement support, but also thinking about how we capture experiences more broadly. I'm a member of the Bereavement Assessment and Evaluation Task Group, which is led by Jonathan Hartley and Linda Machin, who I know many of you know through her development of the Adult Attitude to Grief Scale. And we're hoping to really develop that group as a way of capturing and elaborating some of the discussions and dilemmas that collectively we're facing across the sector. So at the end of today's presentation, I'll give you a few more details about that group and leave you my contact details as well if you'd like to get involved.
We can send them all out.
And we'll send them all out. Thank you, Claire. I also am working on a PhD at the moment, which is validating a new measure for capturing the experiences of children and young people who've been bereaved. It's the Child Bereavement Service questionnaires that some of you have already been using in your service. And recently we've been also looking at adapting those questionnaires to be useful for work with children and young people before a death as well. So thinking about how we can evaluate the difference that services are making at that point. But I wanted to start off really not on the kind of the sort of the hard quantitative data, but actually think about some of the broader ways of capturing experiences. And one of the things that I've noticed a number of services doing very effectively, particularly on Twitter, more so than Facebook recently, is sharing some of the thank yous and feedback that they get from those who are using their services. So a really nice example was shared recently by Grief Encounter, and I think Heather's going to move the slides on.
Yeah, just tell me when you want me to use them.
So this was a note written by Gabriella. who said, I really enjoyed the zip wire, candle making and bonfire. So something about the kind of the activities that were on offer to her through participating in Grief Encounter services. But also, I enjoyed seeing old friends and making new ones. So something about those opportunities for coming together with other bereaved children and realising that she wasn't alone in her experience. So thank you, Grief Encounter, nice spelling of Grief Encounter there, for a lovely experience from Gabriella. Crews also have started to share a number of pieces of feedback from their service as well. So I think an example coming up, my bereavement volunteer helped me to talk about stuff that was locked inside me. She listened and didn't judge. I now feel I can cope with those emotions. I realise I'll have ups and downs, but I now have the mindset to deal with them. Thank you. And I think one of the really important things about both capturing these experiences but also then sharing them is that it doesn't just have an impact on potential funders or supporters of the service, but also about people who might be thinking about whether or not to use a service themselves. So there's something quite important there about being able to generally raise awareness of the sort of difference that a service might be able to make. And then the third example is from Child Bereavement UK's impact report last year. They've been very clear about the fact that they have been measuring impact and effectiveness. They're looking at ways of doing that, and then they are able to present some hard quantitative data within their impact reports alongside some really lovely case studies and examples of things that they've used. So again, I can send a link to that example of an impact report if that's helpful. So I guess that kind of leads me to thinking about, we've got some really nice examples there, but why would we bother to collect feedback? Obviously, making the case for your service is really important, and you'll know more than I the pressures that there are to continually make the case to funders and potential supporters. But as I've said, I think there is also a really important role for sharing some of the work that you do with people who might be considering whether it would be for them as well. But then there's kind of internal benefits as well. So there's something, we can all have those days where you kind of go home at the end of the day thinking, have I actually made any difference? And if you don't ask, you don't necessarily know that. And so sometimes it's important to have a systematic way of capturing feedback so that on those days when you really are thinking, am I doing the right thing? Actually, you've got things to look back on to reassure you. But of course, sometimes it's not just about reassuring that you're doing things well at the moment, but it's also about learning from the experts by experience of those that you're working with and using that to reflect either individually or as a team and then make adjustments to some of the things that you're doing. And we've thought for a while as well about whether there's a sort of a particular responsibility to do that and to learn from bereaved people in our care. When bereaved people are going through a life experience which can so often be about feeling very out of control of what's happening and not having choices about what's happening in their lives, I think there is something quite specifically important within bereavement services about giving some control back to those that are accessing or using the service. We've got an example of Roger Hart's ladder of participation, which is used across UNICEF services. This is an example of young people's participation in services, moving from young people being kind of used as decoration or tokens around service evaluation at the bottom of the ladder, moving up through young people being consulted, but then actually participating in decision making about how services are shaped and run. And then right at the top of the ladder, I always wonder what happens when they get to the top of the step ladder, but young people and adults are genuinely sharing decision making about how services are developed and delivered. I think as well, I've kind of a third reason, as well as kind of making the case for your service and then being able to reflect on and improve your service. One of the things I've been thinking about over the last few days is about the value of capturing the experiences of those that you're working with in terms of making wider policy changes as well. Some of you will have seen the coverage on Thursday and Friday of a Supreme Court case which has given eligibility, we hope is going to give eligibility of widowed parents allowance to unmarried partners for the first time. And really those policy changes which we're seeing have come directly out of the experience of bereaved people. In this particular case, Siobhan McLaughlin, who took the case to court, but more widely, the value of making policy changes to influence the wider agenda for bereaved people. Heather, how do I click? Yep. This one, sorry. Just moving the slides.
Yeah, well, I guess I can manage if you just want to like raise.
Okay, so that's fine. Thank you.
Just raise your hand.
Okay, I'll do that. Brilliant. So I just wanted to turn a bit to thinking about some of the sort of different methods for capturing experiences. I think one of the things to consider is whether you're talking about capturing experiences of bereavement more broadly or experiences specifically of using your service. And I think having a mixture of informal and formal methods is really useful. So sometimes it will just be that you get an email of thanks from someone or a thank you card. So it's not that you've necessarily gone out to seek feedback or seek insights, but that they've come to you. But I think in making sure that you've got some sort of systematic way of capturing those, so whether that's a folder in the filing cabinet where you put those thank you letters, or just some way of being able to go back to them when actually you need to draw on them. If you're kind of proactively choosing an approach, I think it's really helpful to think ahead to what you might want to be able to say using that feedback. So I guess the example going back to Child Bereavement UK's impact report, they would have thought very carefully about how they wanted to be able to report to their funders and more widely, and then thought about the appropriate tool to be able to come up with the answer that they needed. So whether that was a hard quantitative fact about the proportion of bereaved people who had experienced some degree of change, or whether it was feedback about what people liked about accessing the service. And I've put qualitative versus quantitative methods, but actually I think, and I'll come back to this at the end of the presentation, I think it's really important generally to have a mixture of the two and always to think about how you're going to marry those up. Thank you, Heather. So thinking about if you are using a particular measure to try and capture quantitative information, either for funders or for managers within the service, again, you really need to think about, is it going to give you the answers that you need? So a number of people are using the Adult Attitude to Grief Scale, which I've mentioned already, developed by Linda Machin. Some people are using CORE or CORE 10, which is the shorter version of that. Some services use PHQ-9 or GAD-7, and some of you may have been at the symposium on bereavement assessment and evaluation, where Nicola Dias from Cruise gave a really interesting presentation about how they've used those two generic mental health measures within the homicide support service within Cruise. And it was a really interesting use of kind of those very specific measures. I think one of the things that's come out from the discussions that we've had at the Child Bereavement Network is if you are choosing a tool, to think through how many things is it going to be able to answer or to help you to do in one tool. So it's always going to be a challenge to introduce a new piece of paper into a process where volunteers and staff are feeling very established in terms of the way that they work with bereaved people. So the more that you can make the arguments about being able to use a particular tool for different things and to sort of for it to be something that's of wider benefit, I think the better. So something that will be able to help you evaluate the process so that you can say something about what difference, how this has made a difference, how the support that you've offered has made a difference. But then also to be able to evaluate the outcomes, so to evaluate the change, whether that's the change for individuals, but also for groups of bereaved people. And that's probably the point at which you'll be wanting to make some arguments to funders. But also, and many of you will have experience of this, it would be useful to hear from you, is the benefit of tools which can also help you to make clinical decisions. So particularly thinking about how to make decisions about what type of support somebody might want to have. And I know Linda has talked a lot about how the Adult Attitude to Grief Scale, as an example, can be used as a scale which then helps you to determine the sort of level of support that somebody might have. And Heather, if you move on to the next slide, it'll show us an example of, so this is the triangle that many of you will recognise, adapted from the NICE guidance. but Linda has looked at how scores on the adult attitude to grief scale can be used to help determine what level of support somebody might need. So we've talked about a tool that will give you the answers that you need, and that ideally it would you'd be able to use it quite broadly. There is also a really key question about, does it look right? So an example, when we were doing some work at the Childhood Bereavement Network, thinking about what measures we might want to use, some services were being encouraged by their funders to use strengths and difficulties questionnaire, but it did feel quite uncomfortable for them because some of those questions just weren't particularly relevant to bereaved children and their families. So in pure academic psychometric terms, it's about whether a measure has face validity, but actually what we're talking about is, does it look right? Is it the sort of question that you would probably be discussing anyway with a bereaved family? And so does it fit the context in which you would want to be talking to? Then thinking about choosing a tool, you do need to think as well about who else needs to be on board. So that's right through from staff to trustees to audit and quality assurance managers, and to the people who will be doing the data entry from any tool, particularly if it's a pen and paper one. You need to make sure that people have actually got the time to be able to enter the data from it. And then it may be that if you are either choosing a tool or adopting a new tool, that you don't kind of introduce that across the whole team straight away, but through training you maybe have some early adopters within the team that would use a particular measure. And then once you're actually using a tool, you do need to think about how you're going to do the data entry. And that's not just about capturing the quantitative data, but also particularly if you've got fields where you're asking for feedback, how you're going to keep hold of that data. Ideally, a system that's going to allow you to score the data quite easily, but then also really importantly, how you interpret what the answers are that someone has given. So an example that we had recently, we heard about in the child bereavement service questionnaires, we recommend asking a question about, if you had a friend who's in the same circumstances, would you recommend them that they come to this service, that they also came to get help? And one young person had said, no, I wouldn't. And very sensibly, the person who'd asked the question sort of probed that a little bit and said, oh, well, do you want to tell me a bit about that? And it wasn't actually that child was saying, I really wouldn't recommend this service, it was awful. What she was actually saying was, I've learned so much about grief myself through coming to the service that I think I would be able to support my friend myself now. So there was something very insightful that she was saying, which was actually very positive about the service, but which, if it hadn't been properly interpreted, could have been looking as if she wasn't recommending it. So there is something really key about sort of putting the pieces back together and having quantitative and qualitative information, as we talked earlier. I've put a link in the slides for a video clip that you can watch later, which is an example of a film that was put together by Nelson's Journey. We're a bit short of time, so I'm not going to show that to you now, but it's quite a nice example of gathering feedback from young people who had experience of coming together in a group situation, and then using that both to demonstrate the difference that support had made, but also, again, educating the wider community about the support that's there. So I promised that I would share details of the bereavement assessment and evaluation task group, which is a collective effort, really, trying to bring people together who are chewing over some of the dilemmas about how to capture experiences, how to choose tools, how to introduce bits of paper when actually service users and providers are more used to having a kind of an open, ongoing conversation. Or dilemmas about when to do the follow-up if you're measuring change. When do you do the follow-up? When do you stop? What permissions do you need from people if you're using their stories? And when's an appropriate time to do a follow-up measure? So if you're interested in those sorts of dilemmas and you would like to join the wider circulation for that group, please do drop me an email and I can put you in touch with that group. Thank you.
Thank you very much, Alison. What I was going to suggest, because I know Jan Scott's got to leave by 4. Jan, do you want to just talk about a little bit of work you're doing around how you're evaluating, and then we can maybe take some questions for Alison?
Yes, absolutely. Can you hear me okay?
Yeah, we can hear you.
I can see. I can see you on screen. I just haven't got a microphone, so I can see you, and that's
okay,
lovely.
great.
That's lovely.
Floor's all yours.
I didn't have to put my lipstick on, so that's fine. Happy with that.
Neither did I.
So, yes, we're concentrating at the moment on what our buddy scheme would look like, and we thought, well, rather than us sitting and making assumptions about what this service would deliver, we would actually ask some of our recently bereaved people what support was most helpful to them at the time, but what could we have done better, what could have happened going forward. And it was very, very interesting how actually their needs changed at a certain point. So we did this with 21 respondents, and collectively we asked them what support was the most helpful from our hospice after their bereavement. And some of them very classic ones about having someone else who understands, people helping me so that I was not feeling lost and afraid. Complementary therapy was high on their list, as was helping with the disposal of equipment. So that was a very practical issue. After the husband died, they had lots of equipment there, the hospital beds, the frames, the chairs, and actually that became very stressful for a lot of people having to do that. So we then asked, was there anything that would have helped after your bereavement that you didn't have? So this is when they responded very quickly and without an awful lot of thought. So one person said, someone who wouldn't give platitudes but just support and advice. Dealing with my wife's pension caused an enormous distress, and I think that's the phone calls that you have to make soon after a death that can actually be really quite difficult. One chap said, sending my wife's disabled blue badge and freedom pass back. That was, and he went on to say that they had been two things vitally important to his wife, and having no use for them anymore and having to send them back was very stressful. Coping with odd jobs, I just felt lost. Someone to show me how to use my electric cooker and dishwasher. I won't say whether that was male or female. I'll leave that for you to decide. So we then went on to ask the two questions about Orange Line, our buddy scheme. What were tasks or activities that you would have welcomed help with? Had our buddy been in touch with them at that time? Someone to sit, and now this is pre-bereavement, okay, and it changes quite a lot when we ask the question for post-bereavement. So pre-bereavement, to the carer, what would have helped, what would you have welcomed help with? Someone to sit with my relative whilst I went shopping, because often family and friends couldn't do that. Time to go shopping by myself, going on hospital visits, helping filling in certain forms, walking my dog because I didn't want to leave my loved one. More sitting time. So it very much came in about respite there, giving the carer a short break to actually go and perhaps do something they wanted to do. And just someone to hold my hand every so often. So the needs changed when we then asked the question, please could you write down any tasks or activities you'd have welcomed once you had become, you'd lost your partner. First of all, this was an interesting one, to redecorate the room that was used as a hospital bedroom to remove those memories. So I don't know if any of you have had that where your loved ones are cared for at home, but the room very much turns into a hospital setting. I've experienced this myself with my own father when he died at home, and actually to redecorate, freshen that room was high on their list. Helping again with forms, particularly probate, a light bulb replacement. Again, I won't say whether that was male or female, but you might be able to guess. And actually, changing a light bulb, if you are not very able-bodied is very difficult. Above your head, 2 arms, it's difficult. Anyway, car maintenance, mowing the lawn, general repairs, having things to do in the winter. So obviously this must have been a winter bereavement when suddenly those dark nights, it gets dark very early, people close their curtains, perhaps they feel slightly more shut off. Helping with the shopping. And one person said shopping for one person instead of 2 became very difficult. And actually we thought that would be something, because eating alone came out of that as well. It wasn't just the shopping, oh, I've only got to buy for one person now. You're actually cooking and eating alone, where in the past you would have normally ate together. So that is going to be one of our strong buddy elements, is actually doing that first shop, or even maybe 2 or 3 shops with that person, and actually having lunch with them, preparing lunch together and actually eating together. Seemed to be people would have been very keen on that. A lot of them were practical issues with heating problems, hoovers, stuff going on in the garden. But generally, there were lots of practical things that people wanted to do. But bless his heart, it was one gentleman that said, I couldn't even boil an egg. So clearly, we need to think about what people's skills are and what they can do, and maybe getting people to actually help each other. So we hope that what this has told us will help shape the way our buddy scheme could deliver the services going forward. And that's really hot off the press. So I don't know whether that's helped or hindered, or I'll pass back to you, because I'm sorry, I do have to go.
Okay, thank you. Has anybody got any comments for Jan before she runs away? Any comments from anybody?
I think it's a brilliant system, the idea of having a buddy for bereaved carers, and I really like the way Jan has found out what the issues are from their point of view, rather than us thinking and guessing what they need. So
yes.
Congratulations, I just think it's really good.
Yeah, and the group thoroughly enjoyed doing it, and I know enjoyed a strange word, but actually reminiscing about also helped them realise how far they'd come.
Yeah.
That they were, issues that they had to conquer at the time, but actually reflecting back, I think, was quite a positive thing for them to do as well. So quite a useful exercise.
At our hospice at St Christopher's, we and also I know they do it at St Joseph's as well. There's compassionate neighbours.
Yes, that's right.
And it sounds, and we know that what you're talking about, Jan, sounds similar, not necessarily the same, but very similar, and the need is great.
Yes, we did look at that last year and we applied. I just don't think the hospice at that point was ready at that point to go forward. And what scared us a lot was the numbers, that they said, well, we want you to have 60 volunteers in a very short space of time. And to be honest, it all seemed a bit overwhelming. But certainly I think something that once we get this body off the ground, the scheme off the ground, that's something we can relook at, and I think we'll be keen to do that.
I'm just thinking maybe for the next webinar, we were talking about volunteers. Is it worth having a presentation around the compassionate neighbours?
Definitely, yeah, great.
Okay.
Anyway, enjoy the rest of your meeting, everybody. Thank you
very much, Jan. And you can listen to the rest of it because we're recording it. So if you want to pick up the other bits you've missed, you'll be able to listen to it.
Fantastic. Thanks, Marie. Take care, everyone. And good night. Bye.
Can we come back if anybody's got any immediate questions for Alison from her presentation around the different ways to look at evaluation and impact?
I think it's not really a question. I guess it was to do with what our
was going to be about.
Right. Yeah.
So, I mean, if you want me to kind of integrate my thoughts about what Alison said in relationship to what we're doing with regard to our bereavement health workers, I think it's quite interesting.
Okay. Anybody else got any comments? I mean, I think what we'll do is hopefully Alison will give us all the links and we can share them all so that you can see the different tools. Are all those tools that Alison mentioned familiar to you all?
Yeah.
Probably a mixture. Probably some you're familiar with and some you're not. Okay, I'll take that as some know and some don't. Okay, shall we move on to our next speaker? We seem to have a theme of Jans today. Can we hand it on to Jan Connelly, who's going to talk about the work that she's been doing at St Anne's in Manchester. Jan, can I hand over to yourself?
Yeah, sure. I did mention to Marie that this isn't recent work, and I was concerned that I didn't want people to think we are very active in bereavement evaluation at the moment, but I was happy to share what we've done in the past. So basically there are two things that we've done. One is current, and that's the friends and family test. And we introduced that about 2 years ago into the bereavement service, where the friends and family test is given to patients or clients at discharge. Now, I have to be honest and say we haven't had a lot back. I can't give you the percentage returns because we haven't got the data for how many has been sent out. But the ones that we've had back, they do say that they are very likely to recommend the service for those that might need it. So all of them have said that, and it is very good to give the feedback to the bereavement team, as Alison mentioned in her presentation. It gives them that feedback that they're doing a good job and it's valued. So that is an ongoing thing. What we're planning to do is, it's been going, as I say, for a couple of years, and we're thinking of adding extra questions. Those that have used the friends and family test, you'll know that they give you their template, and they do say now if you want to add extra questions, that's fine. And it's that balance of making it very easy to complete and therefore good returns, or adding questions that might make it go into the pile of things to do later and never get completed. So that is something that I'd be discussing with the bereavement team to see what are the critical questions that will be helpful for them. The other thing that we've done twice is a postal bereavement survey. And we did one a long time ago in 2002. I mean, I'm amazed when I look back and I think, crikey, I don't believe it was that long ago. But it was really, time just flies, doesn't it? But it was really useful because the questions really related to communication and emotional support. So it's quite different to what Jan was describing. And also their perception of care while their loved one was dying. And also the bereavement support that they had after death. So at that time we gave everybody a phone call and we invited them to a service of remembrance and thanksgiving. And then at that time there were social workers, counsellors that were there that were able to be contacted at that service, and further support could be offered if needed. That particular survey was very useful because it identified various things that we assumed they were aware of. One basic example was that 50% of the people that returned the survey didn't realise they could stay overnight, which you would think everybody would realise, but clearly they didn't. That led to us doing a facilities leaflet that gave all sorts of information in a very accessible way. The other thing was they commented about the service of remembrance and thanksgiving that they were invited to. They felt that it wasn't very child friendly, so some people couldn't attend because their children who they wanted to bring with them weren't occupied. So that was easy to sort. We got children's activities, you know, even toys and books and that sort of thing in the children's area. So some very, very basic things that we just didn't even anticipate were going to be raised, along with other things. So we were able to get an action plan. Over 100 people responded, so we felt as though it took quite a while to get those responses, but we felt that it was a reasonable cohort to do the actions. And then we did another one in 2009, But just to tell you the methodology that we used was that we sent a letter and a prepaid envelope to carers of patients that had died, but it was 6 months previously. So if somebody died in January, 6 months later, they would receive a letter. The carer, the main carer, would receive a letter saying asking whether they would be willing to complete a questionnaire on their views of the bereavement service. So it was an opt-in, not an opt-out system. And I think we were just very sensitive that we didn't want to dig up issues for them by them completing this survey without their permission. By just sending them a survey, it just seemed a bit risky. And again, like Alison alluded to in her presentation, they were really pleased to be able to express their views. We were very nervous at that point, were people going to be unhappy that they were being contacted? But we didn't get anything like that. It was about, actually, it's really nice to be able to make comments and give our views. So between 33 and 24% of those that were sent a letter said that they would be happy to receive the questionnaire. The separate figures, because we have 2 hospices, one at Heel Green and one at Little Halton. And then between 64 and 82% actually returned the questionnaire. So the response rate was good once they had agreed that they were going to receive and return a questionnaire. So the completed questionnaires, if you take the whole cohort of people that were bereaved, was around 20%. So low if you look at it as a complete number, but those who were willing to do so did return them. So that for the second survey, we didn't get an awful lot of actions, other than one of the comments was around awareness of the availability and access of the chaplaincy service. So we were able to address that because I think it highlighted that our service wasn't as accessible as we thought it was. And indeed, some of the nurses on the wards were struggling to get hold of on-call chaplains. So it made us review that service and access to it. And probably without asking them, we wouldn't have known, we'd have assumed that it was okay. And I think this is what I feel is a big learning when you get the user views. It's often things that you least expect that they raise. So I think those are the 2 things. And as I was saying to Marie, we're keen generally to review the way we get the users as service users. It's not just about bereaved carers, it's everybody. And so I sort of welcome being involved in this group and any other that can sort of update and refresh how we gain the views of our users.
Thank you, Jan. Jan, can I ask you what questionnaire you used? Was it one based on a recognised one, or was it something that you developed yourselves?
It wasn't. It literally was developed by just looking at the service that we provide. So it was questions on communication, and it was questions relating to whether they received the phone call that they should have received 6 weeks after the death from one of our bereavement support workers, whether they were invited to the service of remembrance, what they thought about the service, and that's where they gave the suggestion of it being more children friendly, and whether they just generally had any other suggestions around emotional support. So it was very much based, the questionnaire reflected the service that we provide at St. Anne's.
Okay, thank you. Any questions from anyone for Jan?
It's not really a question, but we've done something very similar to St Mary's, and we are looking at producing a new questionnaire which reflects our current service provision. But we also introduced some narrative work where somebody went out to visit clients that we supported, and maybe 2 times, 3 times, however long was needed to capture a narrative picture. And it was through that method that we were able to look at service improvements. So small things like Jan said, and real practical things, such as having an option directly into the bereavement team at the hospice, rather than someone having to come directly through to reception and then passed on to the team. And that was a real quick, simple thing that we're able to do, but was able to make a difference.
Yes, yeah.
Great.
Who actually visited them? So they went to their homes, did they?
They did. They were given the option whether to come into the hospice or to visit them in the homes. And it was one of our narrative researchers who we had a small pot of money for a narrative researcher to come into the hospice to really review our services. And we get such positive feedback, but it's trying to get under that, all that positive feedback and trying to get areas that we can continuously improve our service.
Fantastic.
Yeah,
Thank you.
it's a really good idea. It's resourcing that, isn't it?
It
But
is.
if you're able to get, yeah, but I think then you can tease out the answers to the questions, can't you? And it's a bit like we do patient interviews, patients on the wards and in daycare. And if they were filling it in themselves, you would only have what they've recorded on the form. If you're there, you can actually ask the questions and dig a bit, can't you? So I totally appreciate that.
You can, and I think one of the questionnaires we got back was very, very positive. But when the narrative researcher went out to the same person, you know, we picked up areas we could improve on.
Yeah.
Alison, do you want to come in with a final question? Then we'll move on to our final presentation.
It was really a comment, I think, just again that kind of theme of getting feedback that sort of gets under the positive feedback that you might have had and gets towards to having some suggestions, because it's about kind of being brave enough to ask if there are any improvements that can be made to the service, or if there are things that can be tweaked, aren't there? Because otherwise the only improvements come through complaints, and that tends to be more about firefighting. So it is about making finding out those little tweaks that could make a huge difference to actually how someone experiences accessing the service. And if you don't ask, you don't get.
And I think that point's really important, is that you actually asked and you're taking action, because so many people ask things and then nothing happens, but you've actually, you've taken action. So that's great. So thank you very much, Jan. Can I also, I don't know whether it's helpful for everybody else, but Jan and Lindsay, I think you mentioned questionnaires that you're doing. Would that be useful to share amongst the group around the questions that you're developing? Would that be helpful to people? Once I can see on the screen, do you want to nod?
Yes.
Yeah, absolutely.
That's great. It's really funny because we've got some people we can see, some people we can't see. It's really entertaining. Okay, so shall we move on to our final presentation, which I think is it going to be a double act from Paul and Christine from St Christopher's? Is that right?
It's possibly a double act, but I don't think Christine's got access to microphone. She's in a different part of London today, so I think she's been listening. So it sounds like it's just me, which is absolutely fine. So, so I guess talking about our bereavement help point.
Can we mute everybody else?
So bereavement.
We could just mute your song.
Is allow the community to get access to information and advice and some support, whether that's quite informal support, not formal therapy, but just access to support because they need to have access to normalising their bereavement response. And we found that when it's a really early part of the referral, it's much too early for them to have access to anything through the hospice directly, and it's also difficult sometimes for them to. Can you still hear me? Yeah.
Heather's worked her magic, and we can hear you better. Yeah, brilliant. Also, I don't get feedback, so whatever you've just done, it's perfect because I don't get feedback through my phone. Thank you, Heather. So we're really trying to stop referrals and stop over-professionalising that they must have therapeutic input. So the bereavement help points haven't started yet, although they're about to start. We've got 2 sites up, just about ready to start at the very end of September. We've got another site starting at the beginning of October, and we've got 1 more still to negotiate on. We've been thinking carefully about what we already do at the hospice as far as evaluation in comparison to the fact that this really is kind of a drop-in service. It could be that somebody's there just for literally 30 seconds
and then there might be other people that are regular users of the bereavement help point. So we're trying to think about, well, what do we already use at the hospice? Let's not try and reinvent the wheel, but let's still have something bespoke for the bereavement help points themselves. So if you look at what we already use, other than, say, the Voices questionnaire, we're really keen already to find out about our service and what the client has as an experience of bereavement support. So whether that's group work support or one-to-one support, all of our clients, once they've finished therapy, get a bespoke questionnaire from us, which has two levels of questions, really. One level is all about the service that they received and whether they felt that it was timely, whether they felt that they had confidence and trust in the volunteer, whether they felt they had enough information and advice, and whether they had enough sessions, and whether they would recommend the service to other people. So that's one element of that questionnaire. And then the other element of that same questionnaire is about their bereavement experience. It's what Alison was talking about right at the beginning of her presentation. We've got questions around if the client had any difficulties with medication or having to take medication, whether they were sleep deprived, whether they had alcohol issues, whether they had difficulty eating, whether they had difficulty with focusing and concentration, and maybe also, if appropriate, returning to work or not being able to work. We've got part of the questionnaire where they can tick that they did have a problem with that, and then they tick afterwards whether or not they feel it's got any better or worse. So we feel that we've got kind of examples of the experience of bereavement support, as well as experience of the service, and also whether they feel better for it. So we're going to definitely do some form of formal responses where it can be a tick box for those people that feel that they can access that. Informal question responses would be for us something quite qualitative. So it would be them being able to just put on a sticky label, just on a post-it note, how they felt that their experience was today. Because it's all about what was the experience today, because the 4 bereavement help points look very different in different settings. And also it's important that it's only that the experience of the bereaved in that moment. If they came back to that bereavement help point a month later, 2 months later, 1 year later, their needs would change as well. So I think that that's important to remember. We've also devised, a bit of my background is working with children as well, and we've devised something that isn't really very complicated at all, but we are going to do literally like you get in maybe a service station toilet, a smiley face, you know, that's green, a yellow face that's medium, and a red face for unhappy. And I think, again, that might appeal for people that are just dropping in, just passing through, because our bereavement help points aren't all about formal referral to a bereavement help point. We're actually in the community where there's through traffic and footfall, and people might just glance, look, pick something up, and at the same time they can put either a token or they can tick a smiley face or not smiley face and just pop it in a box, and then we can get immediate feedback about what that was like that afternoon. And it could have had there might have been other reasons why it wasn't great. I mean, we know in one of our bereavement help points that we're going to have, there is access to a cafe, and there will be some football there, and it's quite a social area. There is another bereavement help point that we've got that actually is going to be relatively difficult to find. So we've got to put extra signage in, but you know, that's what we're going to measure as well, about whether that's affected their experience of their particular bereavement help point. So I thought it was interesting as well. Funnily enough, Alison, I'm in Joseph's Hospice, and we've just had a presentation from Jonathan Hartley all about the audit tool and the bereavement care standards. So I'm in the action head anyway this afternoon. And I thought one of the things that actually he mentioned and you've intimated is, well, what needs did what we offer actually meet their needs? Because what could we do better, I suppose, or what did they actually need? It's not about whether it was good or bad, but again, it's getting under, well, what was bad, because we don't know what we don't know. So we're trying to have enough information of a wide variety of services in our bereavement help points, but that's only based on our X amount of years of experience in the bereavement team and what access to information we do have, and how some of our partner organisations in counselling in general in the different areas of London have actually given us access to their leaflets and information. But, you know, there might be somebody that comes along and we're not meeting their needs, but that doesn't mean that we can't stop getting those leaflets and getting that information and finding out and then putting it into the bereavement help point at a later date. I think for us, we ultimately, because of our tender that we offered, you know, as a reason for doing this, we need to count numbers. Very straightforward, but we do need to count numbers. That's the very least we're going to be doing, is how many people have accessed the bereavement help point. We've had conversations about all sorts of things to do with age and gender and ethnicity and all of that, but we're aware that we're not going to do, are we going to do anything with that information? And I think that's what also you alluded to, Alison. There's no point collecting and collecting information if we're not actually going to do anything with it. And I'm open to responses from anybody in the group here, and also, you know, in the future with that evaluation task group that you mentioned, Alison, about, well, how helpful is it for our particular project to know whether there's an age group, a certain ethnicity or a certain gender coming through our bereavement help points. I can't quite visualise what I would do with that information. I can visualise numbers because I think it might help us understand whether it was useful to have it in a high footfall area, or whether that actually put people off because they didn't want to be seen going to a bereavement help point. You know, those are things that I think are interesting from a research point of view. I'd be interested to hear everybody else's view, and also the ethical dilemma of, are we going to ask everybody about their age and ethnicity and gender as well? I can't see it, but I'm happy to be swayed on that if people think it's going to be useful.
Thanks, Paul. Sorry, Paul, just to interrupt. I'm just conscious of time, and I'd be really good to get Alison's thoughts on that.
Specifically on the question about age and gender.
Yes.
I mean, I completely agree with Paul that if you're not going to use data, it's not that ethical to be collecting it. So, but I suppose particularly in terms of whether or not a new service is responding to a need in the community, being able to look at whether you're getting the sort of the for example, the gender breakdown that you would expect, knowing what proportions of people at different age groups are bereaved in the community. It may be quite useful, particularly at an early stage, to be able to get a picture of whether you are kind of meeting those that you would expect to be meeting, or whether there might be particular groups that you would want to target. But I do think that particularly when it's a drop-in service like the help point, it's a bit like, you know, the dilemmas around evaluating a telephone helpline, because if people are making one call, how do you capture the changes that you might be making for those people? And so I think the only thing that you can do to kind of work out what it was that someone needed when they came, and then whether that need has been responded to. I know that at the St Giles help points, they have just a really tiny little sort of postcard-sized feedback. I don't think they put them out at every session, but they are there on some sessions, and that definitely captures why it was that somebody came along on the day. And I think that's so that they can then kind of check back that that's one of the outcomes that the service is hitting. But it'd be really interesting to hear from anyone else about whether they have views about capturing demographic data.
Any views from members?
So we've got 3 bereavement information hubs now running. They've been running for 2 months. and we're using SurveyMonkey to capture whether it's the first visit, how they heard about the hubs, and what was the reason for them visiting us. So sometimes it can be difficult to try and ask people for that information. If it's their first visit, they may be particularly upset, or there might not be an appropriate time to say, oh, by the way, how did you hear about us, etc. So with a bit of talking, you can kind of gather that information yourself, and then you can pop it into the survey afterwards. So we're just capturing how people are hearing about us and the reasons for them coming, because as Paul was saying, it's very much a drop-in session. We don't want to go into any real in-depth information. We're just trying to capture where people are coming from, the areas, in case we need to target other areas. And if there's some, so the last information hub, one of the ladies said, I'm really glad I came. I didn't think I'd talk today. I would just capture that as part of a chat that I had with the lady, but we don't do anything with that information other than I know about it. What we would do though is when people have come for maybe a second, third, fourth visit, by the sixth visit if they've come back, then do kind of like a bit more of an in-depth conversation with them about why they came in the first place and how have they felt since they've been coming to us. So we look to capture it 6 months, maybe 5-6 months down the line.
Fantastic. Any other comments? Because I'm very conscious of time. I think we've got about 2 minutes left before we get to 1:30. Any other comments from anyone else on the call around demographics and collecting data? No? Okay. I think that's been incredibly interesting. Has anybody else got any other final comments? Because then we can just sort of round up and plan for the next webinar. Any other comments from anybody before we wrap up? No? Okay. So I just want to sort of say that the next webinar is the 1st of October, 3:30 to 4:30. I'm focusing on very much about volunteering and how this is something that you talked about on the Project Leads Day, around volunteering, how people are doing the training, all of those types of things. So we're looking for volunteers from the sites that maybe haven't presented today. If you'd like to present, just to share what you're doing, and we can obviously have discussion around that as well. And also just let you know that we will be coming, getting in contact with you, and we'll be in contact with you about our visits to come and see you. And that will be in the next probably 3 months. So she'll be in touch with you for dates for that. Is there anybody immediately wants to volunteer? I think we talked about having compassionate neighbours. Is there anybody else that wants to volunteer with work they're doing around volunteering? Gosh, how many times do you have volunteering in one sentence?
Did you say it was the 1st of October, the next one?
Yes, yes.
I'm not here, but I'd have to speak to Marianne to see if she's available, because I'm on leave for the next one.
Are you going to nominate her then to speak?
I can't do that. But I will mention she's on leave, so I'll mention it when she comes.
Okay. Anybody else want to either nominate themselves or nominate a colleague, or go back and say that they're going to sort of look at it? Lindsay, from your perspective?
Yeah, I think we wouldn't mind looking at it. Would it be possible for one of our volunteers to join the conversation?
Yeah, that would be fantastic. I mean, yeah. I think that would be really useful. So, yeah, we can come to you, Lindsay, then, and see about you. And I see Paul's got this thumbs up. Are you happy to do something too? Great. Yeah. Okay, fantastic. Well, thank you for bearing with us with the technology. It'd be great if we can get more of you on screen. We'll share all the links, and if you've got things you want to share as well with the things you've talked about today, that'd be fantastic, so we can get that shared. And thank you, Alison, and thank you, everybody, for speaking. And happy rest of the afternoon.
Thank you.
Thank you very much.
Thank you. Bye-bye.